Good evening. I'm Michael Kayemba, the founder and CEO of UZURI. UZURI is a Swahili word for wellness. And I would like you to think, when was the last time you went to your primary care physician? 6 months ago, 3 months ago, perhaps a month ago. And for the people in the back, when was the last time you went to your beautician? Perhaps for a manicure, pedicure, or a haircut for gentlemen. Well, if you're like me, you've probably gone to your primary care physician fewer times than you've gone to your PCP. Now, in Uganda, the Ministry of Health recommends that somebody goes for 4 primary care visits over the course of a pregnancy. But our research showed that mothers, expectant mothers, go only 2 times. And the second time is usually the day of the delivery. Now, do you want to know how many times they go to a beauty center? Twice a month. So imagine if for each of their beauty visits, they had the option to see their primary care physician then. How much less would infant mortality rates and maternal mortality rates be reduced? So, if you think that is something that's cool, we agree, because we think that in the 21st century, the way that healthcare is delivered needs to change. We think that we need to adapt our tools to where people are and provide them with the healthcare where they are. Because guess what? Healthcare currently is no longer an issue of access alone. Access has greatly improved across the world, and now there are so many other bottlenecks: time, quality, lack of education, that prevent people from going for primary care visits. So we want to bring healthcare where the people are. We want to meet them where they are and provide them healthcare in the spaces where they are and make it convenient, make it a part of day-to-day life. So it's stressful. We all have many things we have to do over the day. So what if we just brought healthcare as a part of your day-to-day life, where you are when you go for your beauty services, and you have it there? So how would we do that? For example, we would say, come in for a haircut and have a vaccine. And specifically when you come in, we'll see you because you came in for a mani-pedi, and we say, this is the UZURI model, and with UZURI, in addition to obtaining best quality beauty services, you also get a free physician consult if it's your first time. And follow-up is important, so we follow up as well. So you must be wondering, yeah, that's a cool idea, but are people going to like it? Are they going to pay for it anyway? And the answer is yes. So we did the research for you so that you would just invest today and not have to do that yourself. So we ran a couple of surveys, and the model that we are coming up with is a subscription-based model, where people pay us a fee on a monthly basis, and that covers both their primary care and beauty needs. And in Uganda, where the insurance rates vary from a low of about 2% and a high of about 15%, we hope to turn this subscription-based model into community-based insurance. So you must be wondering, what will the uptake be? Are people interested in this? And you can guess we did that research too. So we did a survey of over 400 clients and asked them those questions. Would you obtain healthcare from a salon? 70% said yes. Would you obtain medication from there? And they said yes. So the need is there. The sort of minimum viable project has been proven. And now what we are looking for is, we already have one center in Masaka, Uganda, where we see about 300 clients a month. We are looking to raise 350,000 in convertible debt to build another 4 health and beauty centers. Our gross profit is about 50%. We are looking at a 40 million revenue by year 5. And you can support us by, we are a young team. We are looking for mentorship. We are looking for we are looking to build up an advisory board, visit our website, and looking forward to your questions. I'm sure you have questions.
So with this model, have you thought about using this model also in other countries in Africa and also in other, like in states, United States, using it here in America?
Very good question. The question was, could this model be replicated in other African countries or even other communities within the US? And the answer is yes. So currently we are starting in Uganda, but we realize that this model is very much applicable to the African American community in the US, to the Latina community in the US, and we are hoping to build this out across sub-Saharan Africa. Question 2, yes?
Yeah, so you're dealing with women. Do you have something that's comparable for men?
Actually, we are unisex. We do it for both. We focus on women because they are the locus of healthcare provision in a family, usually. You treat a woman, she'll treat the kids and the husband, usually. So that is the locus of our focus, but it's by no means ending there. Thank you very much. We'll be at the table here for any additional questions.